Chapter 8 is routes of drug administration. You talked a little bit about this when you did your venipuncture class, and Chapter 8 is a very good chapter that you should review. Box 8-1 on page 101 has the 5 rights of drug administration. I would definitely memorize those. They're the right patient, right drug, right amount, right time, and the right route. Here are the key terms for Chapter 8. Most of them you should be familiar with. As you look through the chapter, you will notice that it is a little bit of a review, so if you feel comfortable with the information, don't spend a lot of time on this chapter. If you don't feel as comfortable, then spend some more time reviewing it, and definitely look over the objectives and make sure you can satisfy those. Some of this may be covered in your first aid class or basic medical emergency class, so some of it is going to be quite common. It gives you a pretty good description of what each of those are. It gives you some pictures of the needles going into the skin, at what angle, so you can see the difference between intradermal and subcutaneous because the needles go in at a different angle. It gives you a picture of the different gauge needles on page 109. I think one of the most common size angiocaths we use is a 20 gauge. You don't want to use one that is too big. I know when you donate blood, they either use a 12 or a 14 gauge. Our contrast media is kind of thick, so a larger needle is necessary, at least to get it in there. I would concentrate quite a bit on page 112 with the intravenous method. You will want to know the venipuncture procedure and how to notice extravagances. Again, documentation is key. You want the name of the drug, the dose of the drug, the route that you administered it, the date and the time of administration, and the injection site and how much. It does get into the different types of tubes on page 116. There's endotracheal tubes, central venous lines, pulmonary arterial lines. We x-ray those for placement oftentimes, but we don't inject into them. That would be a nursing or a doctor thing. But we should be familiar with where they are and how they are accessed and what they are used for. The abbreviations on page 119 are very good for you to know. This has been one of the complaints over the years. The clinical instructors say that the general medical terminology has been lost by the students, so please review this, and it is very important for you to know. Again, the learning exercises are there for you to do on pages 121 through 125. I think this chapter is pretty self-explanatory, so I'm not going to go into a lot of what I see in this chapter. If you have any questions, though, please don't hesitate to ask.